This is a role play to show how the alcohol, smoking and substance involvement screening test, the ASSIST, can be used to screen for various substances. Samantha is a 29-year-old female, currently between jobs, and lives with her boyfriend for the past 6 months. Samantha has been going for family planning at the clinic for the past 5 years and has never skipped her appointments until recently. She then became pregnant and had a miscarriage 6 months ago. The sister at the clinic noticed that Samantha has not been coming for her regular 3-month injections and has started wondering what is going on with Samantha. Samantha tells the nurse that she has been feeling very down since the miscarriage and does not want to go through something like that again. After the miscarriage, she started smoking unga with her boyfriend, but very recently started injecting heroin. Her family has rejected her because she had started taking things from their house, and her mother does not want anything to do with her. Samantha does not have any social or familial support and is feeling hopeless about her future. Samantha has indicated that she uses alcohol, cannabis, and opioids.
Hi Samantha, thank you for coming in today. I'm Shanaz, and I noticed that you haven't been coming here for the past few months or regularly, and I'm just wondering what that's about. And if we could perhaps go through the screening tool to see if there's any concerns on your side.
Okay.
Okay, please note that whatever gets discussed here is confidential. I don't discuss this with your family or boyfriend or girlfriend or anybody outside of this clinic. So whatever we discuss is confidential.
Is it going to take really long?
Not long, like maybe 5 to 7 minutes, nothing longer than that. So I'm just wondering if we could go through this screening tool, and it's about alcohol, tobacco and drug use, and I'm just wondering about your experience with these various substances. And these substances can be smoked, snorted, or swallowed, injected, inhaled. And these are things that your doctor did not prescribe for you. So things
Okay.
that you use but a doctor has not prescribed.
So not things I get at the clinic?
No.
Okay.
So it's other things that a doctor has not given you. So if it's okay with you, if we can go through these questions, there's only 8 questions, and if you need anything, you can just stop me and ask me if you need clarification. So for the first question, it asks about your lifetime use. So in your life, so ever, which of the following substances have you used? And I'm just going to give you this card so that you can see what the substances are, and then you can tell me which ones you have used ever in your lifetime.
Okay.
So the first one is tobacco products. I'm wondering if you've used any cigarettes or inches or tobacco.
No, I mean smoking's really bad for you.
Okay, so that's never, you've never ever used those. And then alcohol. Have you ever used any alcohol like beer, wine, spirits?
Yeah, everyone drinks.
Okay.
So
So you
I
use,
have.
okay, so you have used. And then I'm wondering around cannabis. Have you ever used dacha, marijuana, hash?
yes, I mean I do smoke sometimes, not a lot.
Not a lot. Okay, so that's yes. And then have you used any cocaine? So crack cocaine or coke and snorted any of
No.
those? No.
That's pretty expensive, so I
Okay.
haven't done that.
Have you ever used any amphetamines? So things like tuck or ecstasy or speed or even like diet pills?
I tried ecstasy when I was younger,
Okay.
but like much younger.
Much young. Okay, so a while ago. And then the next one is, have you ever used any inhalants like sniffing some paint or glue or any of these things? Thinners, petrol?
No,
No.
no.
Okay. Have you used any sedatives or sleeping pills, or something that a doctor hasn't given to you to sleep?
No, I don't
You know.
take sleeping pills.
And then I'm wondering if you've used any hallucinogens, things like acid, mushrooms, LSD.
What do you mean by hallucinogens?
So,
That's a big word.
so it's those drugs that put you in an altered state. So you maybe like feel things crawling on you, or you see or taste colors, those kind of drugs.
Yeah, I tried that once at a festival, but I didn't like it.
Okay. So mushrooms you've used.
Yeah.
So that's an hallucinogen. And then the last one is, opioids. Have you ever used things like morphine, heroin, unga, sugars? Have you used any of those? And like I said, whatever you tell me here is confidential, so you don't have to worry about that.
Yeah, I mean, I have.
Okay, have you used, which one of those has been, is it heroin or morphine or codeine?
Heroin's like unga, right?
Yeah, so unga?
Yeah,
Unga.
so heroin.
Heroin, okay. Just remember that whatever you tell me, it stays between us. It's totally confidential. Okay. So let's go on. Okay, so that we'll just keep over here. So the next question is about not your lifetime, but for the past 3 months. So if you can just have a look at this calendar, we're now in August. So if we can count back 3 months, so say from May onwards. Okay. So May, June, July.
So from like the middle of May?
Yes. So let's go with the middle of May till the middle of August.
Okay.
So just if you can think back to the past 3 months.
I'll try my best.
Okay. And then I will give you options as well. So I will refer to that in a moment. So in the past 3 months, how often have you used tobacco products?
Well, I've never used it.
Yeah. Okay, so you've never ever used that, so we won't have to worry about that. And then alcohol, I'm wondering how many times in the past 3 months have you used alcohol? It's either never, once or twice in the last 3 months, monthly, which is 1 to 3 times in a month, weekly, 1 to 4 times per week, or daily or almost daily. So just remember, this is for the past 3 months.
Okay. So I drink maybe like once or twice a month.
Okay, once or twice a month, so that would be monthly?
Yeah, that sounds about right.
Okay, so let's go with monthly. And with cannabis, can you tell me how often you've used that in the past 3 months?
Probably the same.
The same?
Yeah,
So we'd go with
maybe once a month.
1 to 3 times in a month for the past 3 months?
Yeah. So
Okay.
like monthly?
Okay, so we'll go with monthly on that. Cocaine, you've said that you've never used that in your life, eh? So you haven't used that in the last 3 months?
I don't use that.
Okay, that's a no. And then the ecstasy that you mentioned, have you used that in the past 3 months?
Definitely not.
No. Okay.
That was when I was like 18.
Okay. You also mentioned you don't do inhalants, so let's go with never in the past 3 months. You don't use sleeping pills as well. And then I'm wondering if you've used mushrooms in the past 3 months.
Definitely not.
No, okay. And so the last one is heroin. You did mention that you've used heroin, so I'm wondering how often in the last 3 months you've used that. And once again, it's either never, once or twice, monthly, weekly, or daily, or almost daily.
I mean, to be honest, this is the last 3 months.
Yeah.
Since I lost my baby, I have been using more.
Okay.
So I lost my baby like 6 months ago.
Oh, I'm so sorry to hear about that.
Yeah, so now I probably use like daily or almost daily.
Okay, so you would say 5 to 7 times per week. Okay, that's fine. Let's move on. Don't worry, whatever you say here is confidential. Okay, I know this must be hard for you, but if we can continue and then we can... Okay. So question 3, once again, it's for the last 3 months. How often have you used or had a strong desire to use alcohol, for example?
I've only really wanted a drink like once or twice, so that would...
Okay, so once...
Not monthly. Yeah, that would...
Yeah, okay, so once or twice in the past 3 months. And the dagga, how often would you use that in the past 3 months? So I have a strong urge or desire for it.
I mean, probably the same, maybe once, maybe twice at the most.
Okay. And then for the heroin, how often have you had a strong desire or urge to use that?
I mean, that's a bit more difficult because if I don't use, then I feel quite sick.
Okay, so you actually need it more regularly.
Probably like almost every day.
Okay, so daily or almost daily. Okay, that's fine. So let's go with 6 daily. Okay, so during the past 3 months, how often has your use of alcohol led to any health, social, legal, or financial problems? So when I say health problems, I mean like, do you have sleeping problems, stomach problems? Do you get ill because of using it? Or does it cause any problems for you at home, with your relationships, with your family?
Yeah, so when I do drink, I drink with my boyfriend and then we have really bad fights.
And then how often does that happen? We can go back to this card. So is it 1 to 2 times in the last 3 months? Is it monthly, 1 to 3 times in a month? Or weekly?
Probably monthly.
Monthly. So 1 to 3
Yeah.
times in a month.
I think so.
Okay. So that would go 1 to 3 times in a month. Okay, so that's monthly. With cannabis, how often has that led to health problems or social problems?
No, it's not really an issue, I don't think. So I would say never.
Never. So that doesn't give you
Yeah.
any worries.
It's not
or
really a problem.
concerns. Okay, that's fine. And I'm wondering about the heroin. How often has that led to health, social, legal, or financial problems?
Yeah, that's tricky because if I don't use, then I get sick. So
Okay, so it gives you health concerns. So you physically feel sick.
yeah, I guess it's that, and it's also like I'm having fights with my
Okay.
mom about it,
Okay.
and like I'm needing more money
So
to buy.
it has led to health problems, relationship problems, social problems, and some financial problems. And how often would you say that happens?
Sure,
Like-
a lot.
Would you say weekly or daily?
Probably closer to daily.
Daily. Okay.
Probably like 5 times a week.
Okay. 5 times a week. So
Yeah.
let's go daily or almost daily. Okay. In the last 3 months, we're moving on to the next question. How often have you failed to do what was normally expected of you because of your use of alcohol? So things like, have you been able to take on responsibilities at home? Are you able to get to work on time
Well, I've
after
actu-
using?
Yeah, so actually, I'm not working now, but when
Okay.
I was working, like I had a really bad hangover or bablas, and then I couldn't go to work.
Okay, so
But that was only the one time.
okay, so not again in the past 3 months,
No.
just that once. Okay, that's fine. And the cannabis?
Like I said, that's not really a problem, so I
Okay.
haven't had any issues
Okay,
around
next.
it.
Okay, so you haven't failed to do anything because of
No.
your dagga use. Okay, so that has not affected your daily functioning. And heroin, how often have you failed to do what was normally expected of you because of the use of heroin? And remember, this is for the past 3 months.
Okay. So probably like a few times a week, I can't do the things I'm supposed to do.
Okay, so would you say that 1 to 4 times per week on a
Yeah.
weekly basis?
I don't think it's every day, but it's like at least a couple of times a week.
Okay, when you are unable to do what you need to do. Okay, so let's go with weekly. Question 6. So just remember now that we're not looking only at the last 3 months. We're
Okay.
looking at ever, so your whole life.
Okay.
Has a friend or relative or anyone else ever expressed concern about your use of alcohol?
Must I answer yes or no? Or
You can answer. So here's another response card. So it's
Okay.
either no, never, nobody has ever had any concerns, or yes, but not in the past 3 months, or yes, in the past 3 months.
Okay. Got it.
So with your alcohol use, has anyone ever expressed concern about your use of alcohol?
Probably yes, but not in the past 3 months.
Not in the past 3 months. Okay, so
It's a long
nobody.
time ago.
Okay, so nobody has expressed any concerns
No.
about alcohol use. And the cannabis, has anybody ever expressed? No. And the ecstasy that you used back in the day, has anyone ever expressed concerns?
No, I mean it was only those few times.
Does that apply to the mushrooms as well?
Yeah, so I mean that was only once, so
Okay.
no one was worried.
Nobody was worried.
Mm-mm.
And your heroin use, has anyone ever expressed concern about the use of heroin?
I guess my family is a little bit worried about that.
Okay.
I mean, they obviously know something's going on.
Yeah, and especially if your mom and you are always fighting about it, so she's concerned about you. Okay.
Yeah, so probably
Would you say yes in the past 3 months?
Yeah, I think so.
So it's quite recent then. Okay, so we're almost at the end. There's 2 more questions.
Okay.
Have you ever tried and failed to control, cut down, or stop using alcohol, for example?
No.
No.
I don't think I drink a lot, so.
Okay, so it's not a problem for you. And the cannabis?
No.
It's
I
not.
hardly use.
So there's no point in stopping if you hardly use. And then the heroin. Have you ever tried or failed to control, cut down, or stop using heroin?
Yeah, so I mean, I think before, like, I lost my baby,
Mm?
I was trying to cut down and I was doing okay.
Okay.
But since then, I mean, it's just it's helping me like cope with
Okay.
that. So I haven't
You
really
haven't-
tried to cut down since then.
So it's helping you cope. And then the last question is, have you ever used any drug by injection?
Mm,
And once again, just remember that whatever you tell me is confidential.
yeah, but I mean, it's only really like happened recently.
Okay. So you have used by injection in the last 3 months. Okay. So you have used in the past 3 months, but not regularly. Can I maybe ask you about the pattern of use? So
Yeah.
how many times in a week would you say you would inject?
It's not all the time.
Oh, okay.
But you know, my boyfriend also uses.
Oh, yeah.
So,
Okay.
like sometimes, because he injects, so sometimes when he injects, then I'll also do it. But not all the time.
Okay. So would you say like once a week?
So like maybe on the weekend once.
Once. Okay. So would you say once a week, but not every week?
Yeah, probably like once on the weekend,
Okay. Once in the
Maybe.
weekend.
maybe less.
Okay. So we've come to the end of the screening tool, and so I just need to do the scoring, and then I'll give you some feedback on that. Is that okay with you?
Okay. Are you going to tell me what the scoring means?
Yes, I will. So once we go through it all, I will then tell you what all the scoring means, and we can take it from there.
Samantha has indicated that she uses alcohol, cannabis, and opioids. We will now go through the separate scoring of these substances to see how these can be interpreted. For alcohol, the score was 19. This is a moderate risk range and indicates that feedback on the level of risk should be provided, as well as brief intervention based on motivational interviewing techniques. For cannabis, Samantha's score was 6. This is also in the moderate risk range, and therefore feedback and a brief intervention would be appropriate. Samantha's score on the assist for opioids was 36, which indicates a high risk and would therefore benefit from specialist treatment. Since she has reported injecting drug use, it is recommended that she is provided with a card that contains the information around the risk of injecting and advice around injection drug use.